Throughout the course of human history, we have faced an ongoing battle against relentless disease-causing microorganisms. These invisible foes and the illnesses they unleash have claimed more lives than anything else in existence. The specific disease that holds the title of deadliest varies across different times and places. As we strive for progress, we've managed to protect ourselves from certain infectious threats. Yet, our innovative nature often exposes us to unforeseen maladies. So let's embark on a thrilling journey through the annals of history's most formidable diseases. Our expedition begins in the era when humanity dwelled in small hunter-gatherer communities. These pre-agricultural nomads encountered diseases primarily through their interactions with animals, soil, and water. Written records are scarce. Bioarchaeologists have uncovered valuable evidence in the form of distinct skeletal growths and lesions, allowing us to diagnose ancient ailments. Research suggests the presence of tuberculosis and treponemal infections during this time. Although these conditions posed a threat to life, large-scale outbreaks were not prominent in this pre-agricultural period. With the advent of agriculture around 12,000 years ago, a new wave of diseases emerged. Early farmers had limited knowledge about waste and water management, setting the stage for the rise of diarrheal diseases such as dysentery. The proliferation of open fields and irrigation created stagnant pools of water, attracting mosquitoes and giving rise to one of history's oldest and deadliest diseases, malaria. The exact toll malaria took on early farmers remains unknown. Along with the vulnerability it exposed them to other lethal infections. Nevertheless, this mosquito-borne illness continued its ruthless spread during humanity's next significant development, urbanization. In small communities, infectious diseases like measles and smallpox eventually exhaust their host population. Densely populated regions with high birth rates provide a fertile ground for fast-evolving viruses like the flu. They continuously infect new individuals and mutate into various strains. When large settlements became commonplace, medical science had not yet advanced enough to effectively treat or identify these evolving variants. Moreover, it was ill-prepared to combat one of the deadliest pandemics in history, the Black Death. From the 1330s to the 1350s, the bubonic plague ravaged Asia, Africa, and Europe, decimating the global population from 475 million to approximately 350 million. Although the plague did not cross the Atlantic until the late 1400s, infection during its peak in Europe, Asia, and North Africa was almost certain, with a fatality rate ranging from 30 to 75%. The impact of the plague was not evenly distributed among the population. Wealthy lords and landowners could shield themselves within their expansive estates, sparing them from the disease's wrath. As medical knowledge progressed, this class disparity became evident in terms of access to healthcare. Such a divide became particularly pronounced during the reign of the next deadly disease. By the early 19th century, tuberculosis had already established itself as one of the leading causes of death in Europe and the Americas. The Industrial Revolution exacerbated the situation, as overcrowded and poorly ventilated living and working conditions turned tuberculosis into an epidemic that claimed the lives of a quarter of Europe's adult population. Unfortunately, the unhealthiest environments were predominantly occupied by impoverished individuals who often went untreated, while the wealthy received the era's most advanced care. As we ventured into the 20th century, the introduction of vaccines became a common practice in many countries. This momentous advancement even led to the eradication of the centuries-old viral threat, known as smallpox. Accompanied by improvements in nutrition and hygiene, these breakthroughs have extended the average human lifespan. Today, with rapid testing and mRNA vaccines, we have the tools to combat new outbreaks promptly. It is disheartening to note that countless regions around the world still lack access to vaccines, leaving them vulnerable to age-old threats. Malaria continues to claim the lives of over 600,000 people annually, with 96% of these deaths occurring in communities across Africa. Tuberculosis continues to afflict millions, with nearly half of the cases concentrated in Southeast Asia. To address these persistent ailments and those yet to emerge, scientists must forge ahead and develop new, more effective medicines. Yet, there is much we can do at present. Governments and healthcare systems must work tirelessly to ensure that existing treatments are accessible to all. Together, we can create a future where no one is left defenseless against the ravages of disease.